So this is a patient who has a right lower lobe lesion, and one of the first things that I would do is to have gone through the scans in detail. I've identified that this is the area that we require to biopsy. I also have a pad on which I will write down the time at which I'm doing the counseling, the date, which is essentially today, and the name of the patient. And once this is done, my sister is already with me here, and she knows who the patient is. We've already figured out the INR, all the other steps have already been taken, and now I will call the patient and the relatives inside and talk to them and describe the procedure to them. So can we call the patient inside? Come Samir, have a seat.
Thank you.
So you're Samir Tule, right? And how are you all related?
Sister.
Brother. And should I continue in English कि मैं हिंदी में बात करूँ कि मैं मराठी में बोलूँ?
English.
English is fine. You're able to hear and understand
Yes.
what I'm saying.
Yes, sir.
Alright. So I need to explain to you what I'm going to be doing. You need to understand that. And if you have any questions, if you don't understand anything, feel free to ask.
Yes, sir.
Yeah. The same goes for you all as well. Alright. So I'll be placing you straight on your back, the way the CT scan was done earlier. You know that you have something in the lungs on the right side, so I'm going to put a needle straight inside, and I will remove whatever comes out of it and send it for testing. I'll be doing this under local anesthesia. The first time I give you the local anesthetic, you will have a little pain, like with any injection in the body. In 30 seconds that pain will go away, after which you will have no pain at the site where we've put the needle inside. You're fine so far? Any questions? Anything that you need to ask?
Anyway, you putting the needle inside. So any pneumothorax like this?
No. So this is only about the local anesthesia. I'm just coming to it, right? So anytime we put a needle anywhere in the body, there is a chance of bleeding. Right? The time that it takes for the bleeding to stop in your case is normal. So even if there is bleeding, it will stop on its own. Sometimes for a couple of seconds, right, if there is a spurt of blood and the blood goes into the rest of the lungs, right, it can come out through the nose or the mouth. Please don't panic. It will stop in 2 or 3 minutes, and going ahead in the future there will be no problems as far as the bleeding is concerned. Alright? The other problem that can occur, as you asked, is an air leak, what we call a pneumothorax. That is, the air in the lungs can come out and it can collect between the lungs and the ribs. Now the chance of that happening in your case is about 30%. And if that happens, about 10 to 100 cc of air will come out and then it will stop on its own. Typically, if it happens, then for a couple of days, when you take a deep breath, you will have a little catch, a little tightness of the chest and a little shoulder tip pain. Whatever it is will reduce on an hourly basis and disappear on its own. Once in a while, this air leak may not stop. Now, if it doesn't stop, it is something that we will come to know here itself over the next 1 or 2 hours. Then we may have to admit you after talking to your doctor, and we'll get a tube put inside. There is no risk to life, but it is an inconvenience you have to bear for 2 or 3 days being in a hospital with a tube sticking out, right? So that is something you should be aware of. Now, luckily in the last 5 years, we've never had a situation where we've had to put a tube inside in anyone, but this can happen to anyone at any time, so you should be aware of this, right? Have you understood this? Yeah? Sagra samajla, barobar, everything is fine.
After the procedure, patient will go to work within how many days?
So, after it is done, right, if there is no air leak, then he will be, first of all, waiting outside for up to an hour. If there is an air leak, then you'll be waiting here for 2-3 hours until I'm sure that the air leak is under control. And then step by step, Yogita's sister will tell you when he can drink water, have food, leave from here. If there is no air leak, he has to rest at home today, but he can go to work from tomorrow. If there is an air leak and it has stopped, then it is better that he rests for 2 days and then goes to work 3 days. He does not. You're from outside Bombay, right?
Yeah.
So, are you going to take a flight?
Yeah, of course.
When were you planning to go back?
Tomorrow.
Okay, so when we puncture the lungs, right, you are not allowed to take a flight. The recommendations are 4 to 6 weeks, but at least for the next 1 or 2 weeks. And if there has been an air leak, then at least another 2-3 weeks. So where do you live? Which part?
Rajasthan.
In Rajasthan. So the only way you'll be able to go, if there is no air leak, you can probably travel by air after 1 week or so. But if there is an air leak, then you'll have to travel only by road. Okay, so that's something that you'll have to remember. Okay, please understand that because that's a big issue.
So after that air leak, will I have problem in breathing?
No. So like I told you before, if typically these air leaks are small and they stop within 5 to 10 minutes, and anyway we'll be monitoring and doing scans every hour to check that. Once the air leak has stopped, it will get absorbed on its own. At the most, you'll have a little catch when you take a deep breath. The problem is only when the air leak doesn't stop. If it doesn't stop, then we have to put a tube inside and remove the air. But that also, again, it's the only inconvenience of having the tube. There's no other problem that will occur.
Sir, how much time it will take to recover after biopsy?
So typically, if everything goes well, then within an hour everything is fine, and then you can just go home and relax for the day. But there is no other problem at all. When you're inside, whatever happens, please don't move. I do this with millimeter precision in the CT scanner. So if you have any questions, anything comes to mind, talk to me. 3 of us will be inside all the time. So my anesthetist, intensivist, his name is Rajesh Tarkas, the sister, and I, right? So don't move your body, turn your head, move your legs. Just talk to me and we can answer whatever issues that are there. The second thing that I need you to focus on is on your breathing. So the way you're breathing right now, regular, normal, shallow breathing. एकदम हळूहळू श्वास घ्यायचा, right? असा श्वासला धरायची गरज नाही. You don't have to hold your breath. You don't have to take a deep breath, release it, or hyperventilate. Just regular, normal, shallow breathing. Okay? And once it is done, as I've told you, the sister will take care of everything, and you have to wait for some time here, depending on whether there is an air leak or no air leak. That duration will depend. Okay. Have you understood everything?
Yes.
Sure. Any other questions? Shall we start?
Yes.
Yeah. So supine position, right lower lobe. So just take him, and then once the scan is done, just call me.
Yes.
All right. Sure. Thank you. Thank you.